Can you hear me? So, we are right now starting the part of a blood supply of the central nervous system. As I said, we will continue it tomorrow, so we'll finish with the blood supply by tomorrow. And we will have 4 extra hours on Saturday where we will continue with a part of the ventricular system, okay, and the formation of the cerebrospinal fluid. So let's start, and here we do have, as I said, the blood supply towards the brain and the spinal cord. And sure, we're talking about the blood vessels, which are normally originating from the heart. Before continuing to talk about the blood vessels, because mainly, sure, till now we didn't talk about the cardiovascular system, but whatever we remember from the basic biology, let's recall this information, and then let's continue to understand what are the arterial structures which are passing towards the CNS. So all of you remember that the cardiovascular system is composed of the heart and the blood vessels, and literally one of the main functions of the heart is to do one thing, is to pump the blood, and that's all. Literally, it's a large muscular pump which simply as a result of the contraction and relaxation cycles is providing the force which pushes the blood towards the blood vessels. Yes, and the part of the blood vessels are participating in the transporting of the blood towards the tissues, and so away from the heart towards the tissues, and vice versa, from the tissues towards the heart. So according to that particular explanation, we can say that all of the blood vessels which transport or carry the blood away from the heart are known as arteries, and the blood vessels which are carrying the blood towards the heart are known as veins. So this was just a small recall of what we know, yes, from the biology. So according to main type of the circulation, which is systemic circulation, all of the arteries will contain the blood which is oxygenated, highly oxygenated. In case of, again, I'm saying important sentence that I'm saying about systemic circulation, particularly the arteries will contain the oxygenated blood. In case of the same systemic circulation, the veins will contain a deoxygenated type of blood, yes, so which is poor in oxygen, simply to say, and rich in carbon dioxide. I'm not saying that oxygen literally is 0 in case of the venous blood, that's not the truth, but it's much poorer compared to the arterial blood, sure. So before continuing to talk about itself, the blood supply towards the CNS, let's recall one more thing, that how the blood vessels are connected to the heart. So what are these gaps, in between? So all of you remember that the heart is the 4-chambered structure, which means that it contains 4 spaces, such as 2 atria and 2 ventricles. Well, in case of the ventricles, which are thicker in their muscular wall, during their contraction a large force is produced, and as a result it pushes the blood particular pressure, yeah, so that it could normally be circulating in the system. So why I'm saying that in case of the ventricles, on one side we call it right ventricle, logically on the right side, yeah, and we do have the left ventricle. So in case of a left ventricle, we do have highly oxygenated blood which is passing directly to the great blood vessel known as aorta. Well, here we have one picture which shows us the aorta, as you can see here, and it shows that yes, we do have the passage. So you see, this is ascending aorta, then aortic arc, and then descending aorta. You see, so these are the parts of the aorta, and you can find that particularly at the aortic arc, where it makes a turn to start to pass inferiorly through the thoracic region and then even towards the abdominal region. We can find that in 95% of the individuals, we can find 3 important branches, and these are: on the right side you can find a large branch which is known as brachiocephalic trunk. On the left side you can see that we have 2 branches which are passing towards the left part of the body. Why I'm saying that, I will explain right now. So brachiocephalic trunk, as you can see here, is passing somewhere at the level of the sternoclavicular joint posterior to it, and somewhere here makes the subdivision into 2 parts. So it's like, you know, bifurcates, and it's dividing into the common carotid and subclavian arteries on the right side of the body. So it's right common carotid, okay, and the right subclavian artery. The rest of the 2 branches, as you can see here, are representing the left common carotid, which is in the middle, as you can see here, and more posterior and lateral to it. This is the left subclavian artery. Now, the most interesting thing is that although you will say, oh, this is the subclavian, and we have heard about that from the Body Systems 1, and we've heard about that when we were talking about the thorax, do you remember? And in the case of the first rib, we were, if you remember, we were describing typical and atypical ribs, and the first one was very atypical, and one of the important bone demarcation was represented by the 2 grooves for subclavian artery and subclavian vein. Yes, so and the name itself, subclavian, literally makes us to understand that we're talking about the structure which is passing under the clavicle. So subclavian, yeah, or subclavius. Well, as a result, most of you will think that, okay, so the subclavian is the one which is normally passing towards the upper limb, and that's true. It is the blood vessel which then gives rise to the blood supply of completely the whole upper limb. And by the way, you remember, in case of plexuses that we've talked this semester about, do you remember that we have mentioned the axillary artery? Yes? So the axillary artery is the continuation of the subclavian artery. We simply demarcate anatomically that the lateral edge of the first rib is the point where subclavian artery converts or transits into the axillary artery. Okay, so why I'm saying that, I want you to understand one important thing, that subclavian artery, although yes, it mainly gives rise to the blood supply of the upper limb and all of the structures, it contributes to the blood supply of the brain as well, and not only the brain, the spinal cord even. So that's why, one more time saying, we do have right and left common carotids, right and left subclavian arteries, and both of these pairs are contributing to the blood supply of the brain and spinal cord. So literally it means that we always have 2 sources for the blood supply in case of the CNS. Is it clear what I'm saying? Good. We can continue now, and like this, I just wanted to make some, introductory part before we would go to all of the blood vessels that we need to know. And coming back here, you can find very nice picture, which is, I think I took it from some of the websites. I liked it because it shows both of the pairs very well. So here we can find common carotids on both of the sides, you see, and here sure we can find the subclavian arteries on both of the sides, where the common carotids, that's why we call it common, because they will try to bifurcate, and they will bifurcate into the external and internal carotid arteries. You see, external and internal carotid arteries. Why I'm saying that? Please remember that the internal carotid artery, which is one of the two main branches of the common carotid, will participate in the blood supply of the brain. Internal one. That's why I put here. I will also open our Snell and we'll show you what I'm talking about. And I think that this PPT will be very helpful, to be honest. Here we do have a blood supply. Give me a second. Wait. So these are the very last chapters for the blood supply, and we'll try to find it for you. Yeah, here we are. This is chapter 17 with the blood supply of the brain and the spinal cord. So some of the textbooks some of the pictures I took from here, some of them are from the different sources in my presentation. So that's why I truly believe that will be useful. You can see that this particular picture and these are very close by what view is this, and how it is passing towards the skull. You can see it here as well, very well, you see. So it's literally the similar type of the picture. Yeah, let's continue. So yeah, as I said, one of the important blood vessels which are passing towards the brain and participate here in the blood supply would be internal carotid arteries, both of them on both of the sides. The second pair of the arteries which are completely participating in the blood supply of the CNS would be the part of the vertebral arteries. Where do they come from? I said that we have two sources. Common carotid gave us internal carotid, and the subclavian is giving us the vertebral artery. So here you can find these are the vertebral arteries. You see, these are the vertebral arteries which are passing towards the CNS. I know that this picture may not designate where exactly they're passing, but at least you can see that yes, the whole blood supply towards the brain is dependent on. Here you can find internal carotid, here you can find vertebral artery. Okay, so two main sources. Now, important thing, what we need to know is the idea where these blood vessels are passing, and that's why I put this important, one sentence about these four arteries which are lying in the subarachnoid space. Well, the most interesting thing is that, why do we need it to know? Because in case of the bleeding, it's important to know what structures are bleeding. These are veins or arteries? Because because of the difference in the blood pressure in both of the structures, we have different manifestation of the bleeding in case, or so the accumulation of the blood, so hemorrhage or hematoma in case of the CNS. So yes, we do have it in the subarachnoid space. As you can see, an important thing, they're making anastomose. So, okay, not maybe directly, I'm sure, the internal carotids and the vertebral arteries, but their branches are producing the connections, so the anastomosis, and as a result we do have the formation of the circle known as the circle of Willis, as you can see here. Why? Because it means that we do have the blood supply towards particular branches from both of the sources, and that's important for the maintenance of the blood supply towards the brain. Although sure, in case of even a small deterioration of a blood supply, I mean the result is tissue damage and a tissue death, and that's what we call cerebrovascular accident, or simply the stroke. One of the most common clinical correlations when we talk about the CNS, this is the deterioration of a blood supply as a result of the stroke. So either it will be, and we'll talk about the strokes tomorrow, either it will be hemorrhagic one, or it will be ischemic. In case of ischemia, we do have the blockade of the blood vessel. Most commonly it can be thrombosis, it can be some embolic type of the structure, we can be simply closing the passage through, so the lumen of the blood vessel is decreasing, and as a result there is no enough of the blood supply. Or it can be the hemorrhagic, so which means that there is a tearing of the walls of the blood vessels, and as a result we do have the hemorrhage, so the bleeding. So that's how it works. You see? Is it clear what I'm saying? Good. So that's why, as we continue, let's talk a bit about the idea of the internal carotid artery and what is composed of and how it is passing through the skull, because I do believe it's clear that both the internal and external carotids and the common carotid are literally passing from the thoracic region towards the head through the neck, which is not guarded, simply to say it is not protected that much, and that's why while passing towards the head, sure, it needs to enter through the it needs to enter into the skull, yes, before it will be passing towards the brain. So, and as we said here, as you can see, so in the part of the passage of this carotid, we do have the carotid canal, which is represented, the most interesting thing, this is the part of the temporal bone, where the temporal bone is represented on the lateral most regions of the skull. Here in this picture you can see the temporal bone in I don't know, it's a brown or orange color. This one is everything the part of a temporal bone. You see, this everything is a temporal bone, and here you can find the parts of the carotid canal where the internal carotids are passing through to enter to the interior of the skull. Okay, so that's how it works. So as we continue, you can find how it is entering from a lateral view in the schematical representation here, and you can find that this internal carotid artery is passing. Okay, there's a structure known as the cavernous sinus We didn't talk about the cavernous sinuses yet. I mean, all of the sinuses yet. I will talk about them on Saturday. And but this is the structure where we do have venous blood and surrounding, so it is passing through the cavernous sinus, as you can see, and gives us several important branches. Well, one of the smallest type of the branches you can see here, which is literally passing towards the region of the eye, sure is known as the ophthalmic type of the artery. So why ophthalmic? Because it's short structure and mainly passes towards the eye. So that's how do you name it. But here we do have then the bifurcation into two important structures. One of them is the anterior cerebral artery, which you can see here in a purple color. And the second one is the medial cerebral artery, which is seen in the green color. So it's really interesting because these two main blood vessels will be supplying, I would say, two-thirds of the brain. Imagine. So these are two most important structures which can be found here. And one more, which is known as the posterior communicating artery. The name itself is very interesting because saying communicating artery, it means that it has somewhere the anastomosis with the other blood vessels, and that's true. So here is the point of the communication between the branches of the internal carotid, and the second source is the branches of the vertebral arteries. So this posterior communicating artery is important in the formation, or it's the one which contributes in the formation of the circle of Willis, meaning that or both of the sources, internal carotid and its branches and the vertebral artery and its branches, are coming to make the anastomose. So and this is the point of anastomosis, one of the most important. So that's how it works. I will make it a bit smaller. Here we do have some important ideas, as you can see, which we need to know. I just took out some parts, from the Snell. So, and the most interesting thing, what we can find here is that when we talk about the internal carotid, you see when it enters to the subarachnoid space, which I told you, yes, so that it should be represented in the subarachnoid space. To be honest, the vertebral artery is the same. It pierces the arachnoid meatus and turns posteriorly to the region of the medial end of a lateral cerebral sulcus. So, meaning that we have it turns back, let's say like that, and then makes the branching only. That's what is very well seen here in this case. You see, it's like makes it turn back and then subdivides into anterior and the medial cerebral arteries, which represent the biggest branches of that artery. So here we can continue to see how it looks like. In case of Snell, it's a bit in a different way how it is done, to be honest. So you see that, okay, we do have the blood supply of the brain, starting with the arteries of the brain, and it just tells you some words about the internal carotid artery, and then directly goes towards the branches. So just immediately, what are they doing and how do they participate in the blood supply? As you can see, then it continues to talk about the vertebral artery, so and the main type of the branches that can be found here. But let's continue with the branches of the internal carotid first, okay? And then let's continue with the part of the vertebral artery. So here we have, one more time, I'm showing you the same picture, which we used to just, recall some information from the biology. And here you can find that, yes, the part of the internal carotid, how it is passing, as you can see, through the carotid canal, okay, and then makes the subdivision. Here it is seen only one part, here and here. These are two anterior cerebral arteries from both of the sides. So that's how it looks like here. So, and the part of the medial cerebral is not seen very well because it is cut in this case. The same picture is found here, as you can see, and we're talking about the part of the ophthalmic artery, which arises, as we already said, as one of the very first branches of the internal carotid arteries. So that's how it looks like, passing towards the parts of the eye and gives rise to the blood supply here. As we continue, what else do we see? So to be more specific, because what you saw in this picture, it was very scarce. Sure, it was showing you just the blood vessels which are produced from the internal carotid, but it doesn't mean that there is only internal carotid and its branches. Yes, how does it look? And what are the anastomoses that can be found? So these communications between two blood vessels, which is very important because they produce collaterals. So collateral blood supply, meaning that if one blood vessel is deteriorated, from the other side you still have some of the blood supply, you know. So that's why sure, it is very much dependent on the diameter of the blood vessel, because as more the blood vessel is branching, sure, the diameter is decreasing, as you understand. Yes, so sure, it's very much and important thing, it's not only about the diameter of a blood vessel, but it means that this blood vessel is supplying small portion or area, yeah, of the tissue. In this case, we're talking about the central nervous system. Why I'm saying that? As smaller will be the blood vessel which is occluded or which is teared. Okay, so sure, the smaller region will get damaged, and we do have this in the surroundings. Still, I mean, in the surrounding tissue, in case if we do have the fast management of the stroke, in this case we can have minimum of the damage, because still these collaterals will be helping in the surrounding parts of the tissue. Although I'm not saying that they are okay, sure not, they are under the risk, because as longer we'll have a lack of a blood supply, as larger will be the area which is damaged. Okay, so that's why these collaterals are very much helpful, and yeah, sure, as smaller the blood vessel, as better, because in this case the area of the damage is much smaller. So to continue, why I'm saying all of this, that's what I want to show you. So coming back to the common carotid artery and its bifurcation into the part of external and internal arteries, as you can see, you can find interesting thing in this much more, I don't know, what is the color? So this is red, this is red. Okay, let's say dark red color. You can find this external carotid, and you can still see that, although yes, we say that there are only two main sources towards the blood supply of the CNS, represented by internal carotid and the vertebral arteries. It doesn't mean that there are no indirect contributions from the external carotid as well. How that happens? Through the anastomosis of much smaller branches, simply. Again, it's not the main blood supply, it's not even one of the important contributors, I would say, but it is also, you see that it simply participates in the formation of this collateral branches, and as a result the anastomosis. For example, in case of the external carotid, we have the occipital artery, so occipital branch, which is passing, as you can see, sure, posteriorly towards the head region, and here we have some of the connections with the posterior cerebral artery, which is representing most commonly one of the branches of the vertebral artery. So can you imagine? The vertebral artery, which comes from a very different source, which is subclavian, has some anastomosis with the external carotid. Or simply internal and external carotid. You see through all of the regions we can find this very small anastomosis. Most commonly these are the branches of external carotid, which are more towards to to the blood supply of, for example, the meninges, or itself the skull bones, which is logical, yeah? So, and that's how it works. Okay, so let's continue here. And in case of the ophthalmic artery, while passing, you see this is the ophthalmic artery, while passing to the portion of the orbit, I do believe you can see it. So this is the one. Here is the internal carotid before it will be subdividing into the anterior and the medial cerebral arteries. It is passing towards the orbital region, and as I already told you, it literally gives rise to the blood supply of the eye and the surrounding tissues. So it will be the eye itself, as you can see here. Important thing here, we do have the part of the structures in the irregular bones, such as ethmoid bone. Do you remember the cranial nerve 1, which is ophthalmic, was passing through the cribriform foraminus of the ethmoid bone, yeah? So this ethmoid bone, it literally contains, like, we call them cells or sinuses. These are like cavities in the bone. So several of the bones which are represented in case of the skull contain this type of excavations. Why? To decrease the weight of the bone. From the other side, the strength of the bone is not decreasing, but the weight is decreasing, okay? So, and as a result, these particular sinuses, sure, they need to be innervated as well as supplied, and the parts of the blood supply here for the frontal as well as ethmoid sinuses is very much dependent on the ophthalmic artery. This is really interesting. As well as you can see how it is passing up and then has the association with the superficial temporal artery. By the way, this is superficial temporal artery is the very terminal branch of the external carotid. And you can see how they are making the anastomosis and giving rise to the blood supply of the frontal area of the scalp as well. Give me a second. Let's have 5 minutes rest, okay?